Hello, this is Dr. Gadusi, and I want to talk to you today about isolation and social distancing, especially in the context of the COVID 19 disease. So, we previously talked about flattening the curve. Briefly, again, we're trying to tell you that if a lot of people get sick all at once, we end up overwhelming the healthcare system. So then it becomes an issue. We do using things like ventilators within the hospital versus taking care of people at a slower rate, where this care in the hospital ends up being sustainable and you end up getting more people out with the care they need. Some ways that we're trying to flatten the curve is social distancing. This is the directives that you may have heard of: staying about 6 feet apart, staying home as much as possible. The reality is, the less time you spend around people, the less likely you are to be around sick people. And so, with this in mind, we're trying to keep everybody away from one another as much as possible. But let's say you do have to go out and you do happen to get exposed with someone with symptoms. In this case, this is where the concept of a quarantine ends up taking place. What happens with the quarantine is people are directed to stay home because there's a concerns that you may have caught something during this time. And at this time, you're not necessarily showing symptoms. So you're staying home because you may be infectious up to 14 days without showing any of these symptoms. So you could actually spread this to other people, getting them sick without doing anything yourself. Now, this is in contrast to people that aren't so lucky, that start feeling ill after said sick contact. Well, these people end up going into isolation. And the reason for this isolation is to keep that individual from spreading it to others. And this isolation needs to take place for at least 7 days from the start of the infection. There are some studies being done. This number may change, but current guidance is at least 7 days. Now, let's say our quarantined individual that we previously talked about does end up getting symptoms. Well, they're going to start that 7 day isolation from that time. Now, although the socially responsible thing to do is stay home, and many of you may be asking if you have to do this, there are federal laws authorizing detainments due to communicable diseases. So even if you decide, hey, I don't care about the social aspect, it's something you need to do. The reality is, overall, this isn't great. It's going to cause multiple hardships, issues with employment, disruption to small and local businesses, but the alternative is even worse. There's going to be a lot of overwhelming of the system, and there's going to be still significant economic impact with that increased mortality. It's going to be tough with the social distancing order, but it will end eventually. When it does, of course, please keep washing your hands, keep covering your cough, stay home if you're sick, don't lick strangers. But much of what we see can be rebuilt. Now, remember, during this time of hardship, there are local, state, and national relief efforts that are currently taking place that you can search for your local levels. Again, this is Dr. Gadusi. Thank you for listening.